through Friday, April the 3rd. For times and locations, we invite everyone to visit DPS website, www.dpsk12.org. To support our neighbors experiencing homelessness, I want to first and foremost recognize the tremendous partnership we have with our community-based service providers. I also want to thank our host team under the leadership of Britta Fisher, who has been working around the clock throughout the weekend to bring about solutions and opportunities for our neighbors experiencing homelessness. They are critical to ensuring every person experiencing homelessness get needed support. We are talking daily to our partners, providing overnight shelter, day shelter, street outreach, permanent supportive housing, harm reduction, and caring for other basic needs like food, showers, and laundry. I will also say they are in the midst of negotiating with several area hotels to secure rooms for our individuals, our family, friends, and neighbors who are experiencing homelessness. They need volunteers, cleaning supplies, and donations, and we especially need personal protective equipment. If you are young, healthy, and showing no signs of symptoms of the virus, providers, both large and small, need volunteers to help. Denver, this is the time we rise up together to help prepare meals, distribute supplies, and to help keep our shelter facilities clean and safe for our guests and workers. And to reiterate again, we need personal protective equipment. Not everyone is able to volunteer in person, so a donation account is already established to accept donations to help our shelters and other service providers purchase much needed supplies. We have partnered with the Mile High United Way to make it easy to help. So you can just visit unitedwaydenver.org/COVID-relief. And our partners at Mile High United Way will take it from there. No matter how you contribute, the community is grateful for your support. Now is the time for us to rise up as neighbors, as residents of this great city. Especially in need of supplies, cleaning supplies, donations can be dropped off between 1 and 4 p.m. Monday through Friday at 2 recreation centers in the city. The MLK Rec Center, located at 3880 Newport Street, and the La Alma Lincoln Park Recreation Center, located at 1325 West 11th. The city is working on multiple options to ensure that everyone has someplace safe and clean to go if they need it. Again, I want to thank Britta Fisher and her team for negotiating with local hotels, area hotels, and we hope to have more information on that in the coming days. We are looking at the city's existing real estate inventory as well and other available facilities to ensure that we have enough space for supplemental shelter and activated respite care. We have installed hand washing stations throughout the city, distributed maps of their locations, and made them available on denvergov.org. And the Wellness Winning continues to distribute wellness kits and behavioral health supplies throughout the city. Now, with all the closures and cancellations, we know our local businesses are being hard hit and the effect that has on their workers and their families. We want to remind all of our residents that there are some programs that we currently have in place to help folks with housing costs and other relief they may need. For example, the property tax relief program for our over 65 living with disability or low income residents. Our temporary rental and utility assistance program, which is better known as TRUA. It helps with emergency rent and utility payments for those who qualify. Denver Human Services offers eviction and rental assistance. And Low Income Energy Assistance Program, better known as LEAP, offers eligible residents help with a portion of their winter home heating bills. There's more information again on denvergov.org/housing. Several departments, including the Office of Economic Development and Opportunity, Department of Finance, and Arts and Venues, are working on supportive measures to help businesses with recovery as the economic impact becomes real. And we're going to have more on this in the next couple of days going forward. Let me pause for a moment to thank our city family members. Employees have gone through extraordinary efforts to make sure that city government operations remain in place. And while we have implemented a remote working opportunity for city employees, again, to help stem the tide of this virus. I want to just send a special thank you to our city employees for all that they're doing to keep the city functioning and making sure we're able to deliver basic services to the people of Denver. We also want to thank our grocery workers who are working around the clock to make sure that shelves remain stocked and to make sure that our grocery stores remain open so that people can access the basic needs that they have for their families. Just to be clear, our response to this virus is going to mean pressing our boundaries between where the city has controls and where we need to insist other industries step up and help us. Proud of how our city and state has pulled together to combat the spread of COVID-19. None of these decisions have been easy ones to make, I can promise you that. But people's response and understanding is what makes these measures effective and what will get us through this together. Keeping these preventive measures, including washing your hands frequently for 20 seconds at a time, practicing social distancing, staying home if you've got flu-like symptoms, and with these new restrictions, mass gatherings, those restrictions do not include grocery stores. We'll make that very clear. If you need to go to the store, treat it like you're preparing for a snowstorm, but we encourage you not to panic buy. Not to panic buy. It is putting everyone in jeopardy. This is a time to show resiliency, and we do that by taking steps to mitigate our chances of catching the virus and supporting our family and neighbors with what they need to get through this very critical time. With that, I will stop and we can take questions.
Mr. Mayor,
yes, Joe.
Maybe this is a question for Mr. McDonald, but how many people in Denver do you anticipate could get this virus, and how many open hospital beds do you have available?
Well, I don't have the data on that real time because, to the mayor's point, this situation is changing hourly at this point. New information is coming in hourly. All of our efforts are to find the right balance and to stem the flow of this illness. And I think that we're doing that successfully with those things the things that we've implemented. I want to make sure I answered your question, though. You asked about number of beds. That's changing every day. And we are looking at and prepared for, even though they're not at capacity, we are preparing for the situation in case they did become at capacity. We're not waiting for that. But I want to make sure I answered your other question. You had asked about hospital beds and something else.
And how many at this rate, looking at the data that you are looking at, how many people in Denver could contract COVID-19?
Well, there's really no way of telling that. You know, everything we're doing is to stem that tide. What I can tell you is that we have 22 presumptive cases. Are there more than that? Likely more than that. But we're tracking the available data and doing everything we can to make sure that the spread is limited.
Is it possible if this virus reaches so many people that the city will not have enough hospital beds? Is that a possibility?
You know, I've learned in public health that you never say nothing's possible or something's impossible. You know, I think that we are being very successful, very balanced with what we're doing. You know, listen, these are very difficult decisions. I want to stress that the timing of the decisions that we're making are critical. And we have to balance that not just with economic considerations and legal considerations, but also public health. If we make decisions too quickly, we could create other public health problems. If we close schools too soon, then children could congregate where there's less oversight. If we close child care facilities too soon, parents could be faced with putting their kids in a situation where there is, again, less oversight or people aren't as trained as child care providers. So every decision that we make is about balance. And I think collectively as administration, we've done that every step of the way.
Mayor Hancock, can you talk about other steps the city's taking to keep people housed? And do you consider other things like waiving rental fees, late fees?
Well, let me ask Rita to step forward.
The question was about what we're doing to house people. To keep people housed. So I want to reiterate 2 points on that. One, we're in daily communication with our shelter and service providers to meet their needs. We need to meet those critical needs right now. including sanitation supplies, in order to meet the needs of our shelters and service providers. As far as housing stability, you heard the mayor talk about redeploying sheriff's deputies away from evictions. That is a step that should help with housing stability. I think also we have nearly $2 million available through our temporary rental and utility assistance program, which is another thing that people can access to get that short-term help that can help them stay and remain housed.
Can the city, does it have the right to tell people to waive the late rental fees? Is that something that's in the power?
I don't think we have the authority. Housing typically falls under a state jurisdiction, so it would be something of the state. And most of it, as you know, we don't own many properties that we're renting out, so there's private property.
And how long will that eviction ban last?
Until further notice.
Mayor Hancock, what about the court systems?
Yes.
Is there any talk about closing the court systems, closing that down as we embrace this new world?
There have been some modifications already with the court system, but no conversations about closing them down. As you know, we have a responsibility to speedy trial, but there have already been modifications and some postponements occurring and some measuring of the number of folks allowed into the jury pool room already. And so we stay in close communication with the county court, the presiding judge, as well as the district judge in terms of how we'll continue to monitor and to make decisions accordingly.
Mayor Hancock, how will the city actually enforce the restrictions on crowds of 50 or more people? At any point, would Denver police get involved in a situation?
You know what we have, particularly with regards to businesses, is Ashley in the room? She's not in the room. Well, I can tell you that our excise and licensing inspectors will be out monitoring, particularly restaurants and bars, with regards to that. This is not about a criminal act. This is more of, again, a public safety move. And while we expect everyone to comply, our inspectors will be active in the city to make sure we're managing it.
And
Are
can
you
you
considering closing movie theaters or gymnasiums like some other cities have done?
Can you repeat the question?
Yeah, the question is whether or not we are considering closing movie theaters and gymnasiums, I think is what you've asked the question. Gyms of that nature. Well, as you know, we already closed our gymnasiums, at least those that are owned by the city of Denver, the recreation. The Soul Cycles, again, they will fall under the 50-person rule that we have in the city of Denver. We ask them if they're not closing, if they fall under that umbrella where they're, not, they're not going to have 50 people in the room. We ask them to continue to follow the precautions that we have laid out in terms of sanitizing rooms on a very regular basis, making sure everyone's washing their hands and social distancing.
So movie theaters can stay open as long as they don't sell more than 50 tickets?
At this point in time, I don't believe movie theaters. I'm looking around the room to see. Go ahead, Bob. Do you have any ideas on that?
Yeah, that's not explicitly called out. Are we talking about that? We're talking about a lot of things, and for those, the order does not specifically call them out, so there are no orders being issued specific to theaters. If they can practice the social distancing requirements and sanitation, we'll continue to evaluate that as time goes on. Now, having said that, 2 days from now, that could change.
What is your message to businesses, hourly workers, people who have been laid off, who don't know what's next for them?
Well, I appreciate that question because, along with keeping everyone safe and healthy, that is something that this group, my team, talks about very regularly. We are very concerned, obviously, about our workers in the city, particularly our hourly workers and people who will be disproportionately impacted by the decisions and certainly the issues of the impact of this virus in our community. We're working now, and hopefully in a few days we'll have some additional information with regards to how we're going to do the best we can within our means to work with our businesses who are being disproportionately impacted by some of the decisions we're having to make as a result. To our employees, of course, we are first asking our employers if at all possible, we're able to keep people employed. That is, as I've talked, and by the way, we're in regular contact with business. We're conducting conference calls. We are talking with them individually and with associations. And to the extent possible, many businesses are trying to keep employees being paid regularly. A lot of this, of course, will be impacted by how long this lasts and how deep it impacts our community. But we're going to continue to talk to them. We're taking suggestions from them, and we're doing everything within our means to help businesses as much as possible with regards to recovery and sustainability going forward.
Mayor, is there anything specific you can address with restaurants and bars that are 8 a.m. tomorrow?
I have talked to several restaurant operators, even before I came down here, who quite frankly understood what we were doing and understood the decision we had to make. And those, again, they're under the understanding they're going to do what they can to keep their employees working as best they can. We'll continue to remain in contact with them right now. As this, again, this is fresh today. This is a decision that we're going to have to continue to work with them in terms of sustainability with their employees and doing what we can to help them. But more importantly, trying to encourage them to try to do whatever they can to aid their employees until further notice.
I know this is unprecedented, but what means does the city have to do something?
We have some economic development tools that we can try to buffer, increase, while at the same time managing the city's financial sustainability. This is going to hit us in a very major way, and we know that. And so we're already thinking about how we can beef up some of those tools and deploy them immediately to help as quickly as possible.
Sorry to interrupt.
Yes.
How many ventilators does Denver Health Medical Center have, and what have folks told you, experts told you, regarding how quickly there could be more patients than ventilators?
Yeah.
Again, I'm not trying to evade the question. It's that the answer to the question changes hourly. I can tell you that they're not at risk at this time for running out of respirators, and they're prepared to bring in more as is needed.
Follow-up question for you. There was a question asked about hospital beds. Have you discussed the idea of maybe clearing out patients that are not critically ill to make room for potential cases of COVID-19? And are you prepared to set up temporary hospitals in certain spaces if we ever come to that?
We are having discussions about all of those things. In fact, a medical doctor from Denver Health and Hospital Authority is sitting right next to me every day in the EOC. We talk about all of those things. In terms of preparing for additional space for those who may not need it in a hospital setting, that is exactly what we are preparing for, if needed, with our partners in Housing Stability, Ms. Britta Fisher.
And temporary hospitals?
Well, I think modified hospitals, I would say, where maybe elevated care is provided. I don't have concrete answers for that yet, because that gets very complicated, but we are working on that.
What's your advice for people tonight, Mayor? I envision perhaps a run to the restaurants to get one last meal in, or packing the brewery to get one last drink in. I mean, what's your advice tonight before your order takes effect at 8 a.m.
The advice is, first of all, understand why we're doing this. Was a very, very hard decision, because I know who's being impacted. I absolutely know. But right now, nothing trumps the public health and safety of all people of Denver. And we would not, trust me, would not have moved in this direction had we not had to, in order to begin to flatten that curve. And that's what our ultimate objective is to save lives and to save the city and to make sure people remain healthy. If you decide to go to a restaurant or a bar, go, but always until 8 o'clock tomorrow morning. Practice good hygiene. Everything we've said: wash your hands, use hand sanitizer, practice social distancing.
Are you encouraging people to do takeout?
Yes, please. I'm glad thanks, Joe, for asking that question. Again, this does not prohibit takeout or grab and go, as well as drive up distribution or delivery. So where there is capacity and you could lawfully do it, we encourage that. This is about, one way we don't talk about keeping people working. That's one way to do that, as well as to practice food security, to combat food insecurity. I saw another question. Yes.
You were emphatic about the need for personal protective equipment and volunteers.
Yes.
Can you talk a little more about that?
I can't stress it. First of all, volunteers. We're going to work to redeploy city employees as we are modifying our work situation in the city of Denver. And so some of our city employees will be helping us to fill the gaps on some of these challenges we have in the city. Two, volunteers are critically needed in many aspects. And if you have a favorite charity that has an external facing service that could be critical at this time, we encourage you to do so. If you don't have an idea, go to our website. We have some information, or go to United Way. We have information on where you could volunteer. But we need help in distributing supplies. We need help delivering supplies, helping people who need to do shopping and things of that nature. We need volunteers. Secondly, the protective equipment that the personal protective equipment that I talked about, the PPE. I just got off the phone with I won't tell you who it is, but I can tell you it's a leading medical authority official in the city, who is fearful that if we don't get PPE equipment into Denver, PPE here in the city of Denver this week, and we're talking about in a matter of a couple days, all of our efforts will come to a screeching halt. Let me give you another example of why this equipment is so important. As we set up these new centers or opportunities to house like, people experiencing homelessness, and volunteers and staff are there to help, they need PPE to be able to fully volunteer to protect themselves as well as to protect those who are coming through the doors. And right now we have a critical shortage. And so, of course, we're calling on the federal government and the state government to get this equipment to Denver as quickly as possible so that we can do everything we can to serve the people in our hospitals as well as in our temporary housing programs.
Are you asking for people, sorry, just to follow up on that, like people who maybe purchase this equipment who don't really need it? Is that, or where are these solutions you're hoping to come from?
Yeah, no, the question is, are we asking people, thank you, Jenny, asking people to, if we're asking people to purchase this equipment, this is
I'm sorry, I'm saying people who did purchase it who maybe don't need it.
No.
Yes.
This is the government's and our ability to make sure that every level of government and every critical service provider within our industry and volunteers who are coming in contact with folks who may be symptomatic or trying to serve people have the ability to protect themselves as well as the public that they're coming in contact with. And right now we are running a critical shortage, and it's not asking people to turn in their equipment. This is part of our federal and state stash that we are looking to have come to Denver as quickly as possible, as well as throughout the state. But I'm representing the people of Denver. We need it in Denver and the metro area as quickly as possible, and I mean within hours.
Efforts to get the housing for homeless people, is it for people who are homeless generally or for people who are, you think are sick? Can you explain that?
Thanks for the question. The question was, who are we trying to house? Is it unhoused persons or is it symptomatic? At our current resourcing levels, we're prioritizing, so we're trying to meet the critical needs within our shelter and service providers and those who are exhibiting those significant respiratory issues. And then we will continue as long as we have the resources. Let me reiterate, we are a part of a big team here at the City of Denver, and we are all working to address this crisis. But at the end of the day, it comes down to individuals who have resources putting them forward. And so that's why I would also ask for those who have vacant apartment buildings, vacant motels, vacant hotels, vacant dorms, if there is an opportunity that we can get that activated, please email housingstability@denvergov.org. And if you as an individual at home are thinking about how you can donate and support this effort, I would reiterate the mayor's point that we want you to go to milehighunitedway.org/COVID-relief.
Again, this is time for us to rise up, Denver. We have a lot of needs to help those who may be in need here. Yes?
Thank you, Mayor Hancock. I understand that a private lab in Aurora just canceled their screenings due to a lack of tests. Does the City of Denver have a plan to provide testing sites with enough tests to make sure that everyone can be tested? Thank you.
We are working towards more testing sites, but you know, we can't wait for that in terms of how we make our decisions, right? We can't wait for positive test results to come back to inform our decisions. That's taking too much time. Resources are limited. We've mentioned a number of those. We're working to fulfill that gap, but in the meantime, we're providing some very strict and a lot of clarity to the guidance that we're offering people in terms of how they can isolate themselves, even in shelter settings. So we're working on that.
Maybe one more question and we'll call it.
What's going to happen with City Council? Have you thought about ordering it canceled for tonight?
Well, the question is what's going to happen with City Council, and are we considering canceling it tonight? First of all, that's the call of the President of the City Council, as you know. And I know they have modified their schedule and their community or public interaction. So I understand that they have canceled their public comment period and minimized, the opportunity for the public to congregate in the chamber so they can conduct their business. I believe also they have modified, if not canceled, many of their committee meetings as a result of some of our actions. Okay. Thank you all very much. Thank you for being here.
Okay. Okay. We're going to take the environment. You hear me, Byron? restaurant and bar order, I was immediately struck that thousands of people likely just heard that they're not going to get a paycheck